Hello, dear friends. I'm Dr. Anil Kamath. I'm a senior consultant surgical oncologist. And let me discuss the topic of colostomy for rectal cancer. So, whenever I discuss about surgery for rectal cancer, the one thing that patients fear worst is whether a colostomy is required. What exactly is a colostomy? Let me show you this picture of a colostomy. So, what is done in colostomy is that a part of the intestine is brought into the abdominal wall, and the patient will have to wear a bag, and the stools come in that bag. So, is colostomy required for all rectal cancers? Definitely not. It's required only for certain rectal cancers. The cancers which are high up in the rectum or in the upper rectal cancers, the requirement for colostomy is less. But as we come down in the mid and lower rectal cancers and cancers which have almost involved the anal sphincters, this is where it becomes important to discuss about colostomy with the patients and relatives. Let me show you a picture of the anal sphincters so that now these are the anal sphincters. These are the muscles which control the passage of stools. So, if these sphincters are damaged, the person will find it very difficult to control stools, and the stools will come out without any control, which is going to severely hamper the quality of life of the patient. Cancer, which is here in the upper rectum, it is quite easy to preserve the sphincters. But a cancer which is very close to the sphincter, it becomes difficult because during surgery, either the sphincters may be damaged because of the cancer itself, or they may be too close to perform the surgery by preserving them. Now, colostomy is of two types. One is a temporary colostomy. Temporary colostomy is done just to protect our anastomosis or new joint. When we make a new joint by cutting across cutting the cancer proximally and distally and joining the two ends, we don't want the stools to come immediately in them because this can lead to leaks. So in these situations, we divert the stools in a much proximal area so that the stools don't come across the anastomosis. This is called a temporary colostomy, and after a few weeks or months, the colostomy can be closed. But there is another subtype of cancers in the low rectum or in the anal canal, which is already involving the sphincters, and here the sphincters have to be removed and cannot be saved. In these cases, the colon is brought out as a permanent colostomy. Here there is no chance to join and make the passage natural again. So temporary colostomy doesn't bother patients so much because they know at some point we are going to close it. But permanent colostomy is what bothers because they have to live their entire life with this bag. Now, can colostomy be avoided in rectal cancer patients? In certain cases, yes. Like I said, upper rectal cancers, usually we avoid colostomy. In mid and lower rectal cancers, sometimes we do a temporary colostomy and we close the colostomy after few months. Now, in those cases in which the cancer is very close to the sphincter and not involving, these present a challenge to the surgeon because technically it is not involving the sphincter and can be preserved, but at the same time during surgery we find it very close to the sphincter and the sphincter may be damaged during the process of surgery. We use different techniques nowadays to enhance the chances of sphincter preservation so as to avoid a permanent colostomy. One of the methods we use is to use what we call neoadjuvant chemotherapy and radiation. So we, rather than perform the surgery directly, we go for chemotherapy and radiation first and then assess the response after chemotherapy and radiation. Quite often we find that the tumor has shrunk quite a bit and is now what was very close to the sphincters earlier is now away from it, making sphincter preservation easier. Thereby we can avoid a permanent colostomy. The other technique that we use is what we call very low resections or intersphincteric resections or ultra low resections. These resections are now possible because of robotic surgery. So we can go deep in the pelvis, separate out the sphincters, and try to preserve the sphincters and thereby maintain the normal passage, even in those tumors which are very close to the sphincter. At the same time, I must tell these are for tumors which have not involved the sphincter. In those cases in which the sphincter is already damaged, the patient already has incontinence, there is no role for preservation and the patient will have to be prepared for a permanent colostomy in these situations. So, in summary, I would like to tell that colostomy is not required in majority of the rectal cancer surgeries. At least permanent colostomy is not required. So, we may do a temporary colostomy which will be closed at a later date. But there is a subset of rectal cancers in which colostomy will have to be done. You will have to discuss the suitability of the rectal cancer for sphincter preservation and avoidance of the colostomy with your treating oncologist. Thank you.